So today we are going to discuss the history taking pattern. This is my whiteboard. I'm trying to show you. You just look over the history taking pattern. Number first is for the MRCP PACES. You should take the chip complaint. Just like a patient comes with chest pain, take the history. And so the number two task is history of the chief complaint. The history of chip complaint is like this: the chest pain. You should then take history or the site, the elaboration of the chip complaints, the onset means the speed, is sudden onset or gradual onset, and the character, or the character is this is tightening, squeezing, and the choking like. It can be MI. So, or if the pain is like the sharp pain, it can be pleurisy, or it can be dull pain, or it can be associated with movement, muscular pain like this. And in radiation, yes, the radiation, the pain of MI, it can be radiated to the upper or the lower, upper to the jaw and the lower sometimes epigastric pain like this. The associated, what are the other thing associated like this? If the pain is associated with nausea or some other autonomic sign symptom like sweating, it can be MI. Or if this is associated with cough or other thing, it can be associated with chest diseases. Now come to the timing. The timing is actually three types. We should ask three questions. The course, if this is continuous or the episodic pain, you should ask this. The pattern of the pain, the night, the morning, at the evening, or during movement, or the other thing. The duration is the continuous or other thing. The pain, the continuous more than 30 minutes, you should think about the acute coronary syndrome. The pain associated with movement, you should think about the neuromuscular causes like this. And the exacerbation and the relieving factor. Exacerbation with movement, it can be chest pain. Exacerbation with the cough, it can be associated with respiratory causes. And the relieving factor, if this is relieved by the rest, it can be neuromuscular cause. If this is relieved by the GTN, it can be acute coronary syndrome. So, for the severity, you should ask about the severity. In the severity, it should be from 0 to 10. You should describe to the patient. 0 is very minimum, the 10 is the maximum pain which you have suffered. So, he didn't describe, it should be maximum 9 out of 10 or 2 out of 10 like this. Okay, now come to the previous history taking pattern. Number 3 is the past history. You should take some medical history, some surgical history too. You should take history of high blood pressure, high cholesterol, high sugar, etc. And the number 4 is there is a mnemonic. First for family history, any familial disease or any family history of like this, diabetes, cancer, hyperlipidemia, or the family history of sign symptom. Have your parents suffered from like this same sign symptom like this? And the A for allergy. Have you any allergy of food or other thing? And the social history. The social, you should ask about the smoking, and the smoker how much cigarette and for how many years like this. You should take the alcohol history. It is very common for UK. And alcohol, how many pints, how many glasses like this. You should take the sexual history. You should elaborate this thing. And you should take the survival history. That means any job, or do you live alone or with your family, or how are the family members like this. You should take also family history, his family history and his parents' history also like this. Now come to the T for traveling and the treatment and the thrombus. So if the pain is associated with traveling, like you just recently married and you traveled, and after that you develop chest pain, it can be Legionella. Okay, because the Legionella disease, the Legionnaire's disease, which is associated with a honeymoon, and if you take the shower in the cold water, that time you can be suffered from Legionnaire's disease. And also you should take the medicine history. From the medicine history you can go through lots of time. I hope the short video will helpful for you. Thank you and be with us. Thank you again. Thanks from Dr. Ataullah's tutorial.